Hello, my name is Leslie Verner, and on behalf of Carolina Breast Friends, I would like to welcome you to today's session entitled All You Need to Know About Acupuncture. Our speaker is David Bonilla, an accomplished acupuncturist with over 2,500 hours of clinical experience. He also has a master's degree in the field. He is also a certified massage therapist, and he studied for over 2 years at the Shanghai College of Traditional Chinese Medicine. David works at Two Trees Acupuncture here in Charlotte. His specialties include working with patients who are experiencing pain, anxiety, sleep disturbances, or who have a chronic or progressive illness. So please join me in welcoming David to our session today.
Hi, everybody. On mute out there. Just a quick correction. I did not study in Shanghai. That was actually my teacher who I studied with him for 2 years. He's a brilliant guy. So just want to clear that up for people. So yeah, I'll just get right to the talk here. The title of the talk is All You Need to Know About Acupuncture. And unfortunately, an hour or even a day is just not long enough. We could do this all the time. We could do this every day, and there's still more to learn about acupuncture and how it can be utilized in your life. And so what I'll do is I'll start talking about acupuncture, but I want to make it clear that acupuncture is just one technique that is part of the toolkit of Chinese medicine as a whole, which includes herbology, meditation techniques, movement therapies, body work. So keep in mind when, I'm a licensed acupuncturist is my title. That's how I, operate. That's my licensing, but it doesn't tell the whole story. So, I'll be mainly focusing on acupuncture, but it's impossible to separate the whole of Chinese medicine because it's such a huge field and it's all interconnected. So, yeah, that being said, the way I'll start talking about this is let's start with how I see a patient, how I see disease, dysfunction. And so that way you can kind of get an understanding of that. We need to clarify first our conception of what is a diagnosis in Chinese medicine as it's contrasted to what we would call biomedicine, which is, when you're under the care of an MD or a DO, nurse practitioner, they're using biomedical diagnoses. So it's a code that you get, it's on your billing for insurance. And the big distinction between the two methods of diagnosis is that biomedical diagnosis, you have it until you don't. So if you get a cancer diagnosis, you have that cancer diagnosis until they tell you that you do not. Chinese medicine diagnosis doesn't really work like that. It's kind of hard to even say, like we use diagnosis as a term of convenience, but it's kind of misleading because what we're really doing is we do pattern recognition. And you can have a pattern that, for whatever reason, you always get sick in the fall. That's your pattern. And lots of people share these patterns. So as a human being, we all have a lot of different things in common as far as our patterns. You can have a pattern your entire life, whether or not that pattern is actually causing you an acute dysfunction or chronic dysfunction, just depends on circumstances like your environment, how you take care of yourself, your social relationships. So Chinese medicine, when we talk about life and diagnosis, we want to know about your entire life. We want to know how you sleep, how you eat, how you socialize, because it really does inform us as to what may be driving patterns above the surface. So a pattern is a clustering of signs, symptoms, and other markers that are recognized by the patient, by the acupuncturist, or other medical professionals. And then Chinese medicine kind of acts as a context to put all of those signs and symptoms in. A pattern that is unrecognized, untreated, unaccounted for in a patient will eventually manifest as symptoms or disease, but not always, right? So you can be born with a certain pattern that predisposes you to low back pain, right? Maybe, or not even born with, you can acquire a pattern. Maybe there's an injury that you suffered and there's a pattern of movement and dysfunction that when you aggravate it by raking the leaves in the front lawn, boom, your pattern shows up. Now, that pattern is still there whether or not you raked the leaves. So it's really triggered by actions and your relationship to the environment, that's just a distinction I want to make very clear when you're talking about visiting a Chinese medicine practitioner for acupuncture. That's how we're actually going to think about disease. A diagnostic pattern is much more akin to something like a weather pattern or a tendency, rather than a concrete diagnosis you carry with you until we tell you that you don't have it anymore. Of course, when you come into the office for a treatment or we're giving you recommendations, we are refining our focus on the acute manifestation of that pattern, because that's what we have to take care of to get you back to normal. But we also account for these patterns as broader tendencies that bounce in and out of manifestation depending on a number of factors. Lifestyle, diet, medications, family history, other causes and conditions will all cause these patterns to flare up or not. One way I like to think about pattern recognition is constellations. If you look up at the night sky, you see millions of stars, yet you recognize constellations. You know, we're told what the Big Dipper is, right? And so you can see it. Now, a constellation is actually just a conceptual framework. It doesn't actually exist. You can't reach out and touch a constellation. It's all just stars, and we create the relationship between them, and then we can recognize that relationship in the sky. A constellation serves as convenient markers for orienting ourselves when we're looking at the night sky. So a constellation, this is astronomy, not acupuncture, but it takes up a section of the night sky. So when we're talking about a constellation such as Ursa Major, it's actually an entire segment of the night sky that's covered by that constellation. Now, a broad constellation such as Ursa Major is actually identified by what is called the asterism, which is the easily identifiable grouping of familiar stars, which is the Big Dipper, which is part of Ursa Major, which is the Big Bear. So in that way, that's how we see patterns in health, right? You have all of these different symptoms and signs. Some bother you, some don't. Maybe your skin flushes at certain times of the day, or when you eat certain foods. These aren't things you normally think of as being an issue, and we don't necessarily think of them as being an issue either, but they all point us towards what is this broader pattern. And so maybe you come to my office and you have 4 different things that you want to talk about. One is really bugging you. What I'm going to do is I'm going to ask you a ton of questions that seem unrelated, but what I'm trying to do, what all acupuncturists are trying to do, is see what the big constellation is that you're presenting with. Because like I said earlier, all humans share these similar pattern tendencies. And so we can recognize these when we're just talking to people, when we're looking at people. So let's say a patient, for example, will present with painful neuropathy of the hands as a result of chemotherapy treatments. Rather than just treating the neuropathy of the hands, we will also ask additional questions that point us in the direction of where is this pattern coming from? In other words, why do some people get neuropathy from one medication and others don't? That comes down to the individual pattern that the person's presenting with before they were even diagnosed with cancer or anything like that. And so these predispositions that are a result of these underlying patterns is what we're actually trying to treat. And yes, we'll do acupuncture for the neuropathy. Of course, we need to reduce the symptoms, but that's just one small piece of what we do. We're actually trying to look deeper and see, how do we resolve the actual pattern, right? And that's why I say this conversation would last forever, because there's so much that actually goes into the study of identifying patterns and their resolution. So we could say that the neuropathy is pointing us towards a diagnostic pattern, and we call that the branch, the neuropathy, the actual acute symptom that you can recognize very easily. Now, the root would be the broader presentation. So we have root and branch theory in Chinese medicine, cause and effect, essentially. Sleep, energy, digestion, signs and symptoms, those are all part of the root diagnosis. Different manifestations of neuropathy, depending on your different pattern, require different treatments. So while there are acupuncture points that I use all the time on almost every patient that comes in with neuropathy, the effectiveness of those points depends on the individual manifestation of the patient and whether or not I'm actually treating the underlying condition. So you always get more out of an acupuncture treatment than just the cessation of your symptoms that you're coming in for. And that brings me to something I've termed myself positive side effects. So we're all, of course, familiar with side effects in medicine. You take a medication for a cough, the side effect becomes dryness. Now, in Chinese medicine, we don't do side effects. There's no such thing as a side effect. It's all an effect. And the reason one medication treats someone differently than another person is because of these underlying patterns that we've been discussing. Now, that being said, when people come in for, let's say, stay with neuropathy. When people come in for neuropathy, a lot of times you're also experiencing sleep disturbance. Maybe you have chemo brain or chemo fog if you're taking chemotherapy. Maybe you have other sequelae of symptoms from radiation therapy or something like that. But we need to address all of those things. Now, when we do acupuncture, hopefully your symptoms improve. But what happens very, very commonly, and this is, I think, why acupuncture is becoming more and more popular, is that you have positive side effects from the treatment. You don't just see a reduction in your symptoms that you're coming in for. You will see better sleep. You will see more energy. You will see clarity of mind. And these are things that, find me a medication that offers positive side effects. It's not very typical. When it is, it's a blessing. It's just something unexpected. We take it like that. But with acupuncture, we are counting on these positive side effects because something, for example, like sleep, if there is sleep disturbance, it's really hard for your body to rebuild its health. So we need to get all the systems of the body firing. We need to get everything in harmony so that your body can actually devote healing potential towards, for example, neuropathy, the acute symptom that you're coming in for. I make the joke when people ask me if there's side effects in acupuncture. I say, of course, there's better sleep, more energy, better digestion, improved mood. This is kind of like a joke, but it's true. This all really does happen when people start getting acupuncture on a consistent basis. Now, the doctor I mentioned that I studied with from Shanghai, he used to say, if you help sleep and stress, everything gets better. So when you're coming in for a particular symptom that you're having trouble with, I really want to know about your sleep. I really want to know about your stress levels. We have to treat that because nothing is really going to get better in a long-term way if we can't get you cycling properly with the natural world, which is the foundation of Chinese medicine. We'll talk more about that. Now, when you get acupuncture, you feel what I term a non-subtle relaxation response. Some people literally say that they feel like they're on a painkiller of some sort. They will have to sit in the waiting room for 5 or 10 minutes and wait before they drive away because they don't feel safe. And that was my experience when I first got acupuncture. That's why I became an acupuncturist, because it was just so puzzling to me how I could feel this way when I just had some needles stuck in me. And of course, my symptoms got better. Now, sleep is typically improved the night of the treatment and maybe a few days afterwards. And again, when your sleep gets better, everything gets better. When your stress response goes away, everything gets better. Because part of what acupuncture does, and this is another thing that things like meditation and exercise and mindfulness and therapy do, is acupuncture increases what we call your window of tolerance. So if your stress level is at a 9, one more thing is the straw that breaks the camel's back. You have a nervous breakdown, you don't sleep for 4 days, whatever it is, you don't feel good. Now with acupuncture, if we can bring that 9 down to a 6 or a 5, then you can actually handle more on your plate. And so the problems in your life, they actually become put in perspective when you're not so acutely stressed. And that's why we say sleep and stress, we fix that, everything gets better. Because realistically, if you're sleeping and you're not super stressed out, whatever medical issue you're dealing with is way, way easier to deal with. Even if we can't make the symptom go away, you'd much rather be less stressed and sleeping better in order to just deal with life. Because even if you don't have a cancer diagnosis or any sort of symptoms, life comes at you every day. It doesn't stop. We've all noticed that throughout the years. So just increasing that window of tolerance through a treatment like acupuncture or therapy, meditation, something like that, very, very important for the treatment plan itself, just so you can kind of harmonize your relationship to the natural world, which is really the goal of Chinese medicine.
David,
Yeah.
David, this is Lynn. I'm going to step in for a second. I've changed my screen. I'm not sure that everybody has done that. If you've still got it in gallery view, all the people that are attending. Hit speaker view, which is at the top of, and then you see David instead of seeing everybody and a whole bunch of heads like Hollywood squares. So if
I'm
you'll
in
hit
gallery
speaker view, then it looks a lot better,
Yeah,
and it's much easier to follow. So
thank you.
if you would do that, that would be fantastic. So
Awesome.
sorry, David.
No, you're
for
fine. I'm in
interrupting, but
gallery view because
your
I need
view
to.
is much better when we can see you. So
Yeah, I'm in gallery view because I need to see if I'm putting people to sleep. So
you
we
can
just
do
need-
whatever, but for everybody else, speaker view.
Yes,
Thank
yes,
you.
yeah, yeah. So one of the things that happens that I see a lot, especially with my cancer patients, cancer treatment in general is, I mean, this is so obvious. It's just so unpleasant. Radiation, chemotherapy, diet restrictions, all this sort of stuff is so unpleasant. Anyone who's been through cancer therapy will tell you this. A lot of people don't look forward to going to the hospital for an infusion or radiation treatment. It's just something you actually dread. This is not controversial, I'm assuming. My insight administering acupuncture as a medical procedure for cancer patients is routinely they tell me this is something I actually look forward to because you will feel more relaxed, you'll feel better than when you came in. And that is powerful. I'm telling you, that is a powerful thing to have something to look forward to. Because you have options, you have possibilities, you can get better, right? And I mean, that's very, very powerful. That's why integrative medicine is catching on so well, because it's giving the patient options to be taught yoga, meditation, diet therapy, things that they can actually control in their life. You don't just have to show up to appointments. And Chinese medicine, I mean, we've been doing integrative medicine for at least 2,000 years. We leave nothing out. If it works, we're going to use it. And so in China, all the acupuncturists are also medical doctors. You know, they're taught how to read a CAT scan and an MRI and all that sort of stuff because they want to integrate everything. And here in the West, we're getting closer to that. You know, we're getting closer. There's teams of acupuncturists working in all sorts of different departments and hospitals around the country. I have many colleagues that are working in oncology departments, pain therapy departments. And it's because of patients demanding these treatments. It's not because doctors all of a sudden think it's a great idea. My dad's a doctor. Lots of love for doctors. He told me to go into this field. But, you know, a doctor has to err on the side of caution. When there's a novel treatment coming up, even if it seems relatively safe, if there's no necessarily peer-reviewed evidence, it's not in their wheelhouse to recommend. But because of Chinese medicine's integration into the West, which has been going on since the 70s, it's been 50 years now since we've been exposed as a culture to Chinese medicine. So many of my patients are referred from doctors. The Novant Integrative Oncology Department sends a lot of their patients to us for acupuncture treatments. And it's because they're seeing the value of giving patients something to hope for, something that is not going to come with a ton of side effects. The side effects that do happen are actually positive ones, like better sleep, better mood. So it's giving patients options. That is the most important thing, because it's re-empowering you. You have a menu to choose from. You don't have to just show up to a hospital visit that you dread and then go home and feel like ick for days until, you know, whatever. And not, again, that's not everyone's experience. Some people do better than others, but for a lot of people, that's the reality. Now, let me go on my notes here. So we need to talk about let me back up. Let's talk about acupuncture itself. So acupuncture is the deliberate insertion of very fine needles to stimulate the body's self-healing mechanisms, self-repair mechanisms. So the part of your body that, for example, if you get a surgery, they cut into you, they sew it, the surgeon does not close the wound, the body closes it. So that is the force, the energy, whatever you want to call it, this kind of conceptual, ethereal framework of healing that you can't really quantify. That's what we're working with as acupuncturists. That's why it's effective as a modality, because to the degree that you can get better, that's the degree that acupuncture, herbal medicine, dietary therapy is actually going to work for you. Now, to the degree that we have to kind of force the body's hand, that's when things like chemotherapy for cancer treatments and radiation, that's when those come into play. Because like Dr. Andrew Weil said at the Integrative Oncology Symposium, by the time you've actually got the cancer diagnosis, the self-healing mechanisms of the body have failed. So that's why integrative medicine is so important. That's why I'm so key. I urge patients to keep following up with medical professionals and visit their doctor and get objective lab reporting, because there's only so much I can do when you're up against kind of a wall like a cancer diagnosis like that. So I would never say that Chinese medicine is going to produce a cure for cancer, because we just know it doesn't work like that. There's no such thing as a cure for cancer. What there is treatments for cancer patients. What there is there's treatments for individuals who are suffering from cancer. And so that's how Chinese medicine looks at it. We would never think that we're going to cure a disease, because that's just not how it works. For one, if you're going to get better, your body's going to do it. And so the degree that you can get better, that's the degree that Chinese medicine is going to work for you. Now, when we insert needles into the body, one thing that happens is, people actually feel sensations. Now, some of you might be familiar with the terms meridians or channels, right? These lines that are in the body that kind of, you've seen the map of the acupuncture man with the different colored lines going down the body. These are the meridians, right? And so for a long time, my conception of meridians was, well, there's these energy lines in the body that carry energy. And that's actually kind of incorrect. What these are is, the classical definition is actually the space between tissues is what the channels are. Now, what the channels really do is they serve as a kind of, as a framework that through each channel, you have blood vessels, you have bone, you have muscle. They signify regions of the body. So when you look at the map and you see, the heart channel goes to the pinky, and you see this narrow little line here, that's not accurate. What it's doing, it's the whole region of the hand here is actually the whole heart channel. So any dysfunction along here, we just call it the heart channel, because it's kind of like a placeholder. We say heart, but just because there's a problem with your pinky doesn't mean you're going to have a heart attack. But this is the language that Chinese medicine has developed. Now, when we insert the needles, a lot of times you'll feel sensation running up these channels. And so I used to ask myself, how did people actually come up with these channels? How did they identify these meridians? But when you get acupuncture, it becomes very, very obvious how they identified them, because you actually feel them. Now, you get a sensation, maybe you feel a dull ache, maybe you feel a lightness, maybe you feel a tingling around the channels and such. And that's a sign that acupuncture is actually working. And it's a sign that the needles have integrated with the nervous system. The nervous system is responding to the treatment. And there's lots of great research showing that neurotransmitters are released, such as serotonin, dopamine. These are relaxation, these are painkiller neurotransmitters. There's the body's opiate. Your body produces opiates. They're called endorphins. The runner's high, this sort of thing. Acupuncture is proven to release these endogenous, what are called self-generated opiates, which is why it works so well for pain. That's why it takes stress response down. That's why it helps you sleep, because sometimes the body is just so overwhelmed that it's almost like it doesn't know how to release these opiates on its own. And so through getting acupuncture treatment, we can stimulate these parts of the body that reduce pain, that reduce inflammation. There's great research that shows that acupuncture stimulates anti-inflammatory markers in the body. Now, you can do acupuncture to someone, you can take blood tests before and after, and you can see these inflammatory markers reduce because anti-inflammatory compounds are being released. There's research showing that immune system responses are very, very strong with acupuncture, that you can mediate T cell responses, which is just basically a very, very powerful immune response the body has to fight disease. I'm talking too much. And so there's all of these things that happen when you stick a needle in the body that we didn't know about until maybe 10, 15 years ago, when doctors and researchers actually started taking a hard look at why patients would be reporting such profound dissipation of symptoms from getting acupuncture. And so, that's something that happens on the individual level when you get acupuncture. But again, what I said earlier about how Chinese medicine practitioners look at how people are nested into a social framework, and we can't leave that out of our diagnostic and treatment plans. It goes without saying that a cancer diagnosis can have a devastating impact on not only the mental, emotional state of the patient, but also their friends and family. It's bad news, right? Nobody wants to hear that. Now, the job of the acupuncturist is to push the body in the right direction, right? So that you come in for a treatment, your neuropathy feels better, your brain fog feels better, whatever it is, it starts to feel better. Now, let's say you go home and you get on the phone and you talk to people, you talk to your family, talk to your friends, and you say, yeah, I had a treatment, I feel better. Now, what that does is it lowers the emotional burden that support network has to engage in, right? Because they can finally say, they can take a breath, okay, they're feeling better, that makes me feel better. So there's these integrated responses that happen within the social circle when someone starts to self-heal, when they start to feel better, everyone around them starts to feel better. So your success is everyone's success. And so that's the integrative portion. That's the deeper integrative portion of the social medicine aspect of acupuncture. And as well, it's very interesting because as a practitioner, I really like it when people have an instantaneous result. That's just my impatience. That's maybe a character flaw of mine. In reality, instantaneous results are great, but Chinese medicine looks towards health as the tending of a garden. You don't celebrate when you put your starts in May. That's not when you celebrate. It feels great, right? You did that. But what you really want to see is through the summer, through the fall, that your garden is resilient, that pests and predators are coming in and having these relationships, and the garden is still healthy, right? We don't want to get rid of all the bugs in the garden. You can't do that, right? It's just like this, maybe I shouldn't say it, but the whole COVID-19 thing happening right now. These viruses and these bacteria, they are part of our world. We cannot do battle with them. All life comes from bacteria and viruses. All life. We are integrated with them. So when we fight them, when we try to defeat them, and we wage war on them, we're waging war on ourselves. And so the Chinese medicine perspective of how we harmonize with these viruses is about harmony. It's about building your natural ability to be in a proper relationship with the natural world. So maybe that's my COVID rant. Done with that. We're not talking about COVID today. Now, the garden metaphor. When we talk about what happens in an acupuncture session, you might come in and you think, okay, he's going to stick some needles in some strange places. I'm going to feel relaxed and I'll feel better and go home. But another thing that we do is we talk about lifestyle, and we talk about diet, and we talk about mental outlook, and we might recommend a meditation of some sort. And what this is a planting of a seed, right? And so you can think of it like this. The acupuncture session has an immediate acute benefit. And then as time goes on from that acupuncture session, the benefit kind of disappears until the next session, until you're better and you don't need it. When we talk about lifestyle, we talk about meditation, we talk about dietary interventions. This is a seed. This is something that you plant in the garden, and it might take months for it to come up. But when it bears fruit, it's very, very strong. It's much stronger than an acupuncture treatment. And so that's why I don't like the label of acupuncturist, because it doesn't say really what I do. It's like calling a plumber a wrench turner. That's just not what they do. They know how to handle the whole plumbing system of your entire house and how it connects to the broader framework of plumbing for the entire city. That's what Chinese medicine does for health. It's not just make this headache go away. It's how do we align ourselves so that the pattern that's causing the headaches to come up in the first place is under control, right? And that might mean, your particular pattern is aggravated by eating excessively spicy food. And it makes me think of a patient I had who, busy architect, super successful architecture practice, tons of employees, and he had terrible anxiety, had terrible stress and anxiety. He couldn't sleep. And I was treating him for a few weeks, and he wasn't really getting better. And I asked him, okay, what are you eating? Like, what is the flavor that you gravitate towards? And he said, oh, I love spicy food. I eat spicy food every day. I go to a Thai restaurant for lunch. I get the 5-alarm Thai, and I sweat, and I love it. And that's my thing. So I said, okay, sorry, I got to rip out the pacifier. Don't eat any spicy food for a week. Come back in and see how you're doing. 1 week later, he came in and he said, David, the anxiety is almost gone, right? Like, I still have stress because I have a busy job, but that overwhelmed feeling, the feeling that he described to me of it's up to his eyeballs, was gone. 2 weeks later, he came back in and he told me that he had a spicy meal at a Thai restaurant, and immediately he felt that sensation come right back up to his eyes. Now, that doesn't mean spicy food causes anxiety. What it means is that his individual presentation was such that his pattern would be aggravated to the point of an acute manifestation, not because he ate spicy food, but because his job, his family life, he was going through a divorce, he was going through all these stressful things, and the spicy food, the pungent flavor, made everything go up, right? It's like when you eat horseradish, everything goes up. When you eat spicy food, things go up. Your face turns red. And so that's how Chinese medicine looks at health. You have all these other pre-existing conditions, so to speak, your social life, your diet, and it might take one thing to set it off, right? And if you don't do that one thing, your body actually is getting a chance to heal and take a break. And so maybe those other stressors don't dig so deep into your consciousness. And that's why the integrative perspective is so, so important. That's why we have to talk about diet. We have to talk about sleep, because it might just be one thing that we tweak, and that sets you on the road to recovery. And that's when we talk about planting a seed, giving a patient the understanding of how their body can be in harmony with the natural world is the most powerful medicine that there is. I know acupuncturists that have practiced for 30 years, and they've actually abandoned needles. They don't use needles anymore. They talk with people, they get to know them, they talk about life, and they talk about how to nourish yourself, how to nourish life preservation. That's the business of acupuncture. That's the business of Chinese medicine. No, I'm not giving up my needles. I really like doing acupuncture. I'm very much into the physical medicine aspect, but that perspective always looms in the background when I'm doing a treatment on someone. How can I give them something that even if they don't come back, they can understand their health in a way that it will prevent a manifestation of their pattern in the future? That's success to me. Because frankly, it's very, very easy to make a headache go away with needles. What's harder is preventing the headaches from coming back in the future. That's Chinese medicine. That's what acupuncture is about. And so if you're going to go to an acupuncturist, that's what I'd encourage you to dig into that aspect of it. Ask questions about, why am I experiencing headaches? Why am I experiencing fatigue and nausea? Right? You don't have a needle deficiency. That's not why you're experiencing headaches and fatigue. What the needles do is they give a short-term acceleration to the healing potential of the body. That's all they can do. We have to make sure that there's not other factors at play. You're not eating too much spicy food or drinking too much alcohol or eating too many cold foods, or, the media you consume plays a part in all of this sort of stuff too. We know we get stressed out. We watch the news all day. We watch bad news all day, and then we wonder why we can't sleep. So it's very, very important, if you're going to visit an acupuncturist, dig deep. Take it as an opportunity to dig deep into your patterns of health. And then you'll know, even if you never come back, you might have an insight into how to prevent a recurrence of whatever it is you're dealing with. Now, let me just zoom out here real quick. The goal of acupuncture is, within the context of oncology, is to support and help the patient feel better. And that's about as specific as I can get when it comes to oncology, because that's what it's all about. You have to feel better, because your life is made up of one day at a time. And if your day is taken over by medical suffering, that's not good. That's not good. And that's why acupuncture within oncology is so powerful, because it's another thing that you can do that's actually not gonna hurt you. It's gonna make you feel better. There are no side effects except for positive side effects. You might get some soreness at the point or something, but that's really the main framework. Now, whenever I'm asked to give a talk about acupuncture, what always happens is we start talking about acupuncture, we start talking about needles and how it works, and T-cell responses and inflammation markers in the bloodstream and positive side effects. And it always leads to where I'm getting to right now, which is we need to talk about moving through life with Chinese medical philosophy, because Chinese medicine originally comes out of the various philosophies of China. Now, I think everyone in here is familiar with the yin and yang. We call it the yin yang, right? It's yin and yang is how you pronounce it. So it's the circle, the squiggly line, and then the two circles within. And so that is the foundation of Chinese medicine. You can understand every aspect of life if you can understand yin and yang dynamics, and I'll explain that. Now, let's talk about why is there a light and a dark, right? Well, that's an observation of the natural world. Yin and yang mean the shady side of the hill and the sunny side of the hill. That's the literal translations of the characters themselves. Now, within the light and the dark, you see those little circles. Within the dark segment, there's a little bit of a white circle, and within the white segment, there's a little bit of a dark circle. And why then, too, is it not two squares with a straight line in the middle? Because that's not life. Life is not neat and tidy. You look at a forest, there's litter everywhere. The forest floor is littered. Nature hates tidiness. That's just not the way life is. Now, the reason that there is like almost a teardrop shape and then an inverted teardrop shape with the white and the dark spaces is because that alludes to a wave function. That one side of it, the yin, is going to turn into the yang eventually. They're going to switch places. Just like everything can be really, really good, and then one day it's not. And what we do as people, without the guidance of these Chinese philosophies, East Asian philosophies, we operate under the illusion of permanence, and that gives us a lot of problems in our life. Because if we understand that yin and yang change into each other constantly, it always means that it's darkest just before dawn. That's just the way life itself is. And then what we have to look at too is the white within the dark and the dark within the light. That is the seed of the other. There's a seed of yin within the yang and a seed of yang within the yin. And that from that seed sprouts the possibility of transformation. And so the day-night cycle, land and water, these are all yin and yang kind of concepts, because what the ancient philosophers did was they took a look at the natural world outside of themselves, and they said, how does life actually work? How does it work, right? Things turn into each other. They change forms. Day turns to night, night turns to day. And your health is the exact same way. And now, one thing I haven't talked about is the circle that contains both of these concepts of yin and yang, and then the line, the curved line down the middle of them. Very, very important concepts that we don't necessarily look at. There's a lot of different ways to interpret this. The interpretation I like and that I operate with is that the circle refers to the containment within time, that you have a lifespan. You have a lifespan allotted to you, a full 100 to 120 years. And then through genetics, environment, personal choices, we chip away at that lifespan, and a good ripe old age is 88 in Chinese culture. If you live to 88, you lived a long time. Now, that circle contains the transformation of yin and yang. Your life within that circle contains all the transformations and permutations of yin and yang. Health-wise, relationship-wise, you see children grow into adults, you see yourself as a child grow into an adult. And then, that brings us to that little line in the middle, that curvy line. It's not a straight line, and that's for a reason, because that curvy line is actually the path of life that you're walking. That's the path of life that you walk between yin and yang. And when you veer too far over into one way or the other, you get lost. And so you don't want to live in the clouds, right? You don't want to not know your zip code, but you also don't want to forget about the transcendent aspects of life, and that this world itself is a miracle. And how do you balance those two? That's the path of life that you walk. That is yin and yang as it applies to you, right? You're in the center of those. You're right in the center of yin and yang. That's your entire life. Now, how does Chinese medicine come out of yin and yang theory? When you go to Chinese medicine school, which maybe you might after this, who knows? The first day, that's what the teacher does. They draw that circle on the board and fill it in with the shading and all that. And they start talking about yin and yang and the transformations of yin and yang. And most people can get by fine without knowing about yin and yang. The Chinese practitioner, Chinese medicine practitioner, has to know about yin and yang, because we have to always communicate to patients that no matter what your situation is, it will change. It will change. Better or worse, right? But there's no such thing as permanence. There's an illusion of permanence that we all kind of operate under. And there is nothing like a diagnosis of severe illness to shatter that illusion of permanence temporarily, because what happens is we then, if life is good, quote unquote, right, and then life is bad, we're only identifying with what we see right in front of us. Like we have these blinders on because of our experience. So it's very, very important that we always try to zoom out and we take a look at the bigger picture. How do we see our life? Does that actually make an impact on how we feel, on how the world interacts with us? Misery loves company, you know that saying? All these cliches, they're cliches because they're true. Now, the acupuncture piece of yin and yang, when I stick a needle into an acupuncture point and I'm trying to take away someone's headache and I'm trying to help them sleep better, what we're doing is we're bringing latent potential possibility of healing, which you could say is the yin portion. It's at rest, it's potential, it's low, it's deep, it's the deep blue ocean. We're bringing up that potential out into the yang, which is your present day-to-day awareness. That's the mountaintop. That's the sun. And so, oh, we got some more guests here. Awesome. So when you're thinking about acupuncture and how it relates to yin and yang, that's what acupuncture is actually doing. Now, biomedicine doesn't do that. Biomedicine is kind of like, we're going to turn on this cellular function, or we're going to turn off this cellular function. You know, like the drug metformin is a diabetes prevention drug. Maybe some of you are taking it. What it does is it actually disables a function within every cell that has to do with glucose metabolism. Now, my job here, I'm not arguing against the prescription of metformin. Some people really need it. But we have to understand that's the key difference between Chinese medicine is we're not actually trying to force the body to do anything. It's almost like we're opening a path. We're opening the body to the transformation of yin disease state into yang health, right? And so, you know, with Chinese medicine philosophy being the origin of this, a lot of Chinese medicine philosophy is about managing uncertainty, because uncertainty drives all of our anxieties. Uncertainty of not knowing what happens tomorrow, right? Raise your hand if you know what happens tomorrow. Nobody knows. And our whole world is existing in this framework. And so what we do is we get educated, we learn, we listen to experts, and then we can be certain. And then it falls apart, right? It falls apart. A projection, a modeling, a theoretical projection into the future is just that. When you actually arrive into the future, when you're here and now, and it's different than what was projected, well, then it's almost like the anxiety about the future is almost, I mean, this may be strong language, I'm not thinking of anything else, but it's almost like an arrogance, like I know what's going to happen. Like dread is almost like it's a certainty in an uncertain world that something bad is going to happen. I'm not going to make it out of this or whatever it is. That Chinese medicine is basically 2,000 years of trying to figure that out. It's 2,000 years and we're still not there, right? Still haven't solved the problem. Uncertainty still exists. But again, there's the yin and yang, right? There's uncertainty, but uncertainty also implies possibility. And so when you're in the center, when you're walking that curved line in the center, you can see that very, very clearly. You can see that uncertainty and possibility are the same thing, and that a negative could be a positive, right? My favorite parable from Eastern philosophy is the farmer. He has a son, and the son goes out and he finds a bunch of wild horses and he brings them back. And the nearby farmers come to the farmer and say, oh, what a blessing for you. You have all these wild horses. And the farmer says, maybe, maybe not. We'll see. The next day, the son is taming the horses. He falls off a horse and breaks his leg. Farmers hear about it. They come up to the other farmer and they say, how unfortunate, your son broke his leg. You must feel awful. He says, maybe, maybe not. We will see. Next week, the army comes through. They're conscripting all the young men to go to battle. Well, the son has a broken leg. He can't go to war. The farmers come over and they say, what a blessing. He can't go to war. Maybe, right? We'll see. And so if I were to impart one thing from this session to you, it's that to take that perspective of taking possibility and uncertainty literally. It means that we don't know the future. When something good happens to you, quote unquote, we don't actually know if it's going to be good long term. And I'll say too, another thing of Chinese medicine philosophy is good and bad is really depending on what your preferences are, right? Nobody wants to lose a finger. But what if the finger's infected and gangrenous? Then you really want to get rid of that finger. And so your perspective, your preferences, you can't be so attached to them because it could change. Your circumstances could change. And then one thing that's bad could all of a sudden be good for you. And so again, this always happens when I start talking about acupuncture. We have to talk about the roots of acupuncture, where acupuncture comes from. Because this is a Zoom call. I can't give you guys acupuncture right now. And so, you know, that's the main thing. That's the main thing with Chinese medicine. That's where acupuncture comes from. Is that when a patient comes into our office, the goal being preserving life, the goal being elucidating these patterns for them, patterns of behavior, patterns of dysfunction, sleep patterns, giving people a way to manage them, to see what's coming, to see the wave before it crests. That is the goal of an acupuncturist. That's the goal, the transcendent goal of Chinese medicine. It's not just about your pain. That's a small amount of what life is really about. But again, going back to that narrow focus we get, when we're in pain, it doesn't matter how bright and sunny it is outside. We're in pain. We need this pain to go away. I understand that. I'm not insensitive to that reality, and I've been there myself. But when the pain's gone, all of a sudden, it's like the world opens up again. And so that's something we talk about as well with patients, is not just where does it hurt, but how does this actually impact your life? What can't you do? What do you want to do that you can't because of this? And then what happens is it actually forces you to take an account of what are your priorities in your life, right? You thought you're coming in for acupuncture. You're about to analyze your entire life and what it is you actually want out of existence itself, right? And that's the power of an acupuncture session. And everyone's got a different style. Some acupuncturists you go to, they talk to you for 5 minutes, they stick needles in, tell you to come back in a week. Other people, they will talk to you for 2 hours, and they want to know every hair on your head as far as what's going on. And there's a spectrum between those two, and they're all useful. They're all good. In some of the old classical texts, they talk about how we need every kind of doctor. We need doctors that will yell you back into health. We need doctors that will hold your hand and be sweet to you. We need doctors that just want to do acupuncture. We need doctors just want to do herbal medicine, just want to focus on dietary therapy. Because it's not a one size fits all. I can't fix everybody. In fact, I can't fix anyone. You have to fix yourself. That's what acupuncture does. It stimulates those self-healing responses. So yeah, that's acupuncture. No.